how and why hormones affect our skin, especially before a monthly cycle or even before ovulation, is when I've heard a lot of people complain about.
In order for us to talk about hormones and how the menstrual cycle would affect any condition, we need to start with the menstrual cycle. And so that's really looking at a couple of different hormones. There's four main hormones that are involved in regulating the cycle, and they move throughout the cycle. This makes it difficult to do testing and understand a little bit more on women versus men, which is why they use men a lot more in medical research. If they don't have a monthly cycle, their hormones aren't going to affect drugs or anything like that. And our hormones really are impactful on our system. So there's four hormones really that regulate the menstrual cycle. There's follicle stimulating hormone known as FSH, a luteinizing hormone known as LH, estradiol, which is one of our estrogens, and progesterone. And they work together over the course of, let's call it a 28-day cycle. That's kind of a typical cycle, is 28 days. So the first day of a cycle is the first day a woman menstruates. And then we count that cycle until the next time that she menstruates. So first day's bleed to first day's bleed, that would be a 28-day cycle. And all four of these hormones are doing like different things throughout the course of the month to cause that whole cycle to happen. So the first phase of menstruation is called the follicular phase. And that makes sense because when we think about the ovary, there's follicles in the ovary and the egg is developing, and then that follicle needs to like finish the development of the egg and then pop the egg out. That's ovulation. So the follicular phase is like the first half of the menstrual cycle, let's say the first 13 days or so. Then ovulation, the egg pops out of the follicle. That's usually around day 14. And then the second half is called the luteal phase. And that's the final half until you actually, when you start menstruating or bleeding. And all these hormones are doing different things. The easiest hormones, I think, for us to focus on are the estrogen, the estradiol, and the progesterone. And that's where we see maybe the biggest impact on those hormones, on the skin, and on what's happening in atopic dermatitis.